Welcome to today's session of Instagram Live, brought to you courtesy the Limi hospitals. My name is Dr. Obajulo, and with me we have
Dr. Yvonne. I am an optometrist.
Alright, so we're going to be talking about gradual loss of vision today. Gradual loss of vision is something that has become a common occurrence in our society today, and that is one of the reasons why the Limi Hospital Group has found it fit to bring this topic to you right from the comfort of your homes. We're going to be touching on a lot of things that could lead to gradual loss of vision. So Doc, can you just explain or elaborate for us, what is this gradual loss of vision? Is it that, I'm seeing today and tomorrow I'm not seeing again?
No, okay, before I start, I would like to say the eye is a window to the world. Without the eye, you can't do much, little or nothing at all. Gradual loss of vision, like the name implies, gradually or slowly, you find out that you are not seeing things the way you should see it. And it can take from weeks to years.
So as the name implies, that means it's gradual. It's something that happens slowly over time.
Yes, over time, over a period of time.
Okay. So are we talking weeks, months, years?
From weeks to years.
Weeks to years.
Yes, it can take time.
Wow. So how common is it? Is it common?
Yes, gradual loss of vision is very common. You see it every day.
Okay, so in your practice, you come across this daily.
Yes.
Is it specific to a particular gender, or is gender neutral, both male, female?
Both male, female, children,
everybody can come down with gradual loss of vision. Okay, so from your experience, what are those things that one would have, or what are those symptoms that one would have that would alert one to, I'm having this gradual loss of vision? Like I mentioned earlier, is it that, okay, maybe you wake up in the morning, you like to do your devotion, read your Bible and all of that. The next thing, you wake up one morning and you realize that you cannot read your Bible again in the morning.
For gradual loss of vision, something must cause you not to see.
Okay.
You understand? For that to happen, the causes can be as a result of refractive error. It can be as a result of glaucoma. I'm talking about the causes now. What can cause it?
What can cause it?
Yes, it can be as a result of refractive error. It can be as a result of glaucoma. It can be as a result of cataract. So many things. It can be as a result of diabetic retinopathy.
Diabetic retinopathy. That's a big word. What does that mean?
Yes, it is a big word. Like the name implies, diabetic retinopathy. And what causes diabetes? Sugar.
Okay. So that means that it's a complication of diabetes.
Complication of diabetes, and it can affect the eye.
Okay. Fair enough. So out of these, like you said, you come across gradual loss of vision almost every day in your practice. From what you've seen, what is the most common cause out of these ones that you've identified?
Refractive error. So
refractive error is actually more common?
Yes.
Okay, so when you mention refractive errors, what are you talking about? Is it that these are, I want to assume that these are problems of refraction, right?
Yes.
That's the way the light, if I remember from basic medical school, refraction is how the eye responds to the light stimulus that is reaching it, right?
Yes.
Okay.
As the name implies, refractive error. That means your vision is impaired. If your vision is impaired, that means things will not be clear.
Alright.
And it has to do, like you said, the shape of the eye. Light does not fall on the retina. And for you to see things well, light has to fall on the retina, for you to appreciate what you are seeing.
Okay. So that means the relationship of the light falling on the retina is what is responsible for whether it is short-sighted or long-sightedness, right? Okay, so that means from the name, short-sightedness means that the light has fallen short of the retina.
Yes, that means the light When light fall, it's not in front of the retina.
It's in front of the retina.
Instead of it to be at the retina.
At the retina itself.
Yes.
Okay.
If you see most short-sighted people, they'll tell you, doctor, I can't see, things are not clear. You'll not see them complaining about headache. They'll tell you, I am not seeing things close to me. They are worried.
Okay.
If things was at far, they will not be that worried. But since it's close and everybody around them is seeing it, they are not seeing it, they are worried.
So that means worry is the common presentation.
Yes.
Okay. So but that means that for long-sightedness now, that means the light is behind the retina.
Yes.
So when people can't see things that are far, they are not as worried because they can see things that are close up.
Yes, things that are close.
Okay.
And you see some people, when they say short-sightedness, you hear some people call them Opolo eye, the most common name. That they have big eye.
Okay,
yes.
Okay.
So that's one of the causes. And in refractive error, we have short-sightedness, we have long-sightedness. That is hyperopia. We also have astigmatism.
Okay, so for astigmatism, what is that? What does that astigmatism?
Astigmatism, the light too is not falling on the retina. Instead, before that, different points on the retina, but not at the retina.
Okay, so it might be half of the retina.
Yes.
Or
it can be, and refractive error. You can give the person glasses to help to correct the error. Okay. It's not a death sentence.
Okay. The reason why I'm asking, I'm really, about astigmatism is because I'm astigmatic, but I really don't. When I ask my eye doctor questions, just don't worry, just use these glasses and everything will be okay.
Okay. For that, and you take note, most people that are astigmatic, they jump lines. They jump lines, they will mix lines.
And that's why reading can be difficult sometimes.
Yes, you see, they have eye strain. They can also have headache.
Okay.
But the most common thing is the jump lines. If you see something like E, they can call it F.
Okay. Alright.
If they see P, they can call it B.
Okay.
The things are not well defined. But with the use of glasses, the glasses will help to push
the light
to fall on the retina for you to appreciate whatever you are seeing.
Okay.
Whether it's at far, is that near,
or at any point.
Yes,
hence the term corrective lenses.
Yes, corrective lenses.
Okay. Then you also mentioned glaucoma as well.
Oh yeah. Before we go to glaucoma, there's another one, presbyopia. Still part of the refractive error.
Okay.
It's due to aging. When you are getting close to 40 or above 40, you need something to help you to relax the eye when you are reading. You see, most people come to the hospital or clinic and say, doctor, I am not seeing. We'll find out, what's your age? You say, I'm 45, but I've been seeing, but recently I just found out that things are not clear. It's because of their age.
Okay.
Their eye muscles, it has to do the work of distance and far.
Okay.
When they were young, they were seeing, but as they get close to 40 or above 40, they are not seeing. It's an aging problem.
Okay, so that means that the accommodation in the eye is not as good as it used to be.
Yes, elasticity.
Elasticity, okay.
Yes.
Alright.
The eye does not bring the things to fall very well on the retina the way it used to be.
Okay.
Then when you are young, if I ask you the things you did 10 years ago and the things you are doing now, you say, no, I'm bigger than that. I'm not doing that anymore.
Yeah.
You say you're not doing that anymore.
True, that's
Maybe
very true.
when you're younger, 5 or 10 years ago, maybe you can walk for like 30 minutes or 45.
Oh yes. Oh, yes.
But now, with so many things, being a big boy, you can't walk for that long. I have a car, I can just drive over and stop close to the shopping center, and within 2 or 3 minutes I'm already there. Why would I take that long walk?
So that's almost the same thing too with the eye. Those things that
Yes, you know, the eye, like I said, is a window to the world. And people don't know that the eye, just as you get older by the day, the eye too is still undergoing aging process.
So,
like your skin now, as you grow older by the day, you see elderly people, you see their skin wrinkled.
True.
The eye too also undergo changes.
Undergo changes.
But you don't see the changes in the eye.
Okay, because it's internal, right? So that's it. You heard that, folks. The eye ages with the way our body ages.
Yes.
So you're welcome once again to this Instagram live session brought to you by the Limi Hospital Groups. Today we're talking with Dr. Yvonne, our resident optometrist, and we're discussing the topic gradual loss of vision. Right. So she has mentioned a lot of things since we started. Just a quick recap. So you said gradual loss of vision is, like the name implies, is loss of vision that happens slowly
over a period of time,
which can go from months to years.
From weeks
to years, all right. And that it's actually quite common, and it doesn't discriminate. It happens between male and female, irrespective, isn't it? And also, we also talked about the most common causes of this gradual loss of vision, and one of them mentioned is refractive errors, right? And these errors, as the name implies, talks about how the light falls on the eye, specifically the retina, either before the retina or after the retina, or in front or in certain positions around the retina. Okay, so you just finished talking about presbyopia, right?
Yes.
Okay, and that is aging of the aging process, the natural aging process of the eye. Okay, I go school small. I still remember. All right.
Yeah, doing well.
Thank you very much. Okay, so you talked about glaucoma as well as a common cause of gradual loss of vision. Glaucoma, I think, is something that almost even the person in the village has heard about glaucoma.
Oh yes, glaucoma, the silent thief of sight. We call it that name because even a thief, when it's coming to rob in your hands, it does not give you any previous information that is coming. It's as a result of increased intraocular pressure. The pressure in the eye is increased.
But this increase in pressure, is it normal?
No. The normal, there's fluid. If you are looking at people's eyes, you see.
That's when you do fundoscopy.
Yes. No, even as you're looking at my eye now, you see as if there's water in the eye, but it's not tearing.
Yes, it's not tearing.
Imagine if that water dry up. It will lead to another condition on its own, and that is a discussion for another day. But the amount of fluid in the eye is equal to the amount of fluid that will leave the eye. But if that condition is not met, if the normal process
of water going in and going out is not met,
there will be increase in pressure.
Okay, so that means that the rate of water going in is higher than the rate of water fluid
going in and out.
Okay, so that is what actually leads to block. So that means that water will now lead to that increase
in pressure in the eye.
Okay, is that what it means when people are saying, let me check your pressure, let me check your pressure?
Yes, because the pressure, yes, tonometry, the pressure in the eye can collapse the eye.
Really?
Yes. The ultimate goal of glaucoma is to cause blindness. And it can cause blindness on both eyes, but not at the same time.
At the same time. So usually one is affected more than the other.
Yes, like the patient I was saying today, He said when his mom went for an eye check, they told her that she was having increased pressure. So when he came over, he said the mom did not allow him to drop his bag. The mom just said, we are going out. Ah, mommy, where are we going to? He said, don't worry, when we get here, you'll know. The mom just took him straight to the hospital and he was surprised. Ah, mommy, I thought when you said we're going now, that means we are going.
We are going out.
And saying maybe to enjoy ourselves or something. But we found out that it was the hospital, and when they checked his pressure, it was high.
Okay, so does that mean that glaucoma is hereditary? It's familiar, there's a familiar history to it?
Yes.
Oh, wow.
It can be hereditary. If you see any of your loved ones or your family member has glaucoma, one person, that means every other person. If your sibling, one of them has glaucoma, everybody will be tested for it.
Everyone is suspect.
Yes, is a suspect
until proven innocent.
Or guilty. Or guilty.
Okay, fair enough. So what are the, okay, so...
And glaucoma too can lead to tunnel vision.
Tunnel vision?
Yes, it has a pinhole.
Okay, how does that happen?
Because when glaucoma occurs, it starts eating from the side.
Okay, from the periphery?
From the periphery.
Okay.
All around. And before you know, you're having tunnel vision. Even when you can see things straight, but the side, it's not clear.
So that means you have to turn your head?
Yes. Maybe straight now as you are looking, this side will not be clear. But once you turn your head, you see, it starts affecting from the side, from the periphery. And before you know, you go. And it does not have, it can affect the two eyes at the same time, but one eye will be more affected than the other eye. Yes.
Is it treatable?
It can be managed.
It can be managed?
Yes. And they also do surgery for it. But, you know, even with the surgery, after a couple of years, they'll still refer you to still take your medication. And one thing with glaucoma is vision loss cannot be regained.
Wow. So once one has it, it has come to stay.
Yes.
So that means the best thing to do is to get regular eye checkups. Yeah.
No waiting.
No waiting.
No waiting. Once you just hear, Mr. A has it and it's part of the family.
Just go and let yourself check.
Yes, go and check. Regular eye checkup. And sometimes you can have increased pressure. Your pressure can be high, but the nerves, the optic nerves are not damaged.
Are not damaged?
Yes, that's what we call ocular hypertension.
Ocular hypertension?
Yes.
Can that be salvaged?
Yes, with drugs.
Okay, so that means the drugs would ultimately lead to reduction in the pressure
of the eye.
And the pressure of the eye.
Yes.
So that means at the end of the day, it's regular checks, regular checks, regular checks.
Yes.
Okay, so for your clinic, you open every day?
Yes, Monday to Friday.
Monday to Friday. So anybody that wants to get an eye check can just walk in and ask, and demand to be shown the eye clinic, and you can conduct all these tests.
Yes, all the tests has to be conducted for you to know whether the person has glaucoma, and there is glaucoma screening. Okay,
there's a special screening just for glaucoma.
Yes.
And we offer that?
Oh yes, we do, and we even have glaucoma week, and there's this certifically set aside for glaucoma. Yes. The test we do, if you want to know whether you have glaucoma, we do tonometry. Tonometry was one we're talking about. It helps to check the pressure on the eye.
Okay.
We do fundoscopy using the ophthalmoscope, which helps to check the back of the eye to know if the back of the eye is okay. We do perimetry, which help to check your field.
Okay, yeah.
The way we talk, the one we talk about your sight and your peripheral vision.
Okay.
We also do the pachymetry, which help to check your cornea thickness. No, these are the front of there is what we call the cornea.
Yes.
It has to be within a certain range, just like glaucoma. If you want to know normal pressure for glaucoma, it's from 10 to 21 millimeter mercury. But if it's above that, in most cases you are a suspect.
Proving otherwise.
Yes.
Wow, that's interesting. So,
and we also do for that is we do the OCT, which is called the optical coherence tomography. It helps to check the cross section of the back of the eye. The back of the eye is really a wonderful part of the eye. They also do gonoscopy. It uses a special lens with a slit lamp, with the help of a slit lamp, to check your eye drainage angle. Glaucoma, wonderful topic. Because it has so many tests for you to confirm. Because once you start taking the drugs, no stopping.
No stopping.
No stopping.
So that means you must confirm that this patient has glaucoma and start medication as a when due. And the best thing is advise people to get their eye checks. Is it how many times a year? Once a year? Twice a year?
Yeah, you can check your eye once a year, the way you go for your health checkup. But the thing is, if you are having issues, it can be pain, it can be redness, it can be discharge. If you're having any eye issues or any discomfort in the eye, you don't need to wait till
that
it's a year.
The earlier you present, the better.
Yes, early detection, early key. Early to bed, early to rise.
Alright, that's wonderful. Then you also mentioned another cause of gradual loss of vision as the age-related macular degeneration. Well, is that like presbyopia or it's different?
It's different. The age-related macular degeneration is like the name implies, it is age-related and it affects the macula.
Okay, the macula.
It affects the retina. It's part of the eye.
Okay, so the presbyopia affects only the retina.
The presbyopia is a natural process on its own.
Okay, natural process of aging.
Yes, natural process of aging. Once you are getting close to 40 or above 40, you need something to help you to relax the eye muscles so that you can see things well, things that are close, especially reading. And as you age, the power that the eye needs increases. You don't expect the thing you do at 40, you still be doing it at 50 years old. So the eye power too changes.
Okay.
When you are 62,
the same thing.
Yes, it changes. It's like I said before, the things you do when you were younger, and if I ask you to do it now, it's not the same thing. You say, there are some things I'm bigger than. When I was young, when I was in school then, I did this, I did that. But now, did I do that? No, it's not me. You're missing me with somebody. Maybe it's my twin or my younger brother. We look alike. So things like that happen. Yeah. You understand? So for the age-related macular degeneration, it affects elderly people and it affects the macula.
The macula specifically.
Yes.
Okay.
As you are growing, you're not the people that are young having such. But for refractive errors, for glaucoma,
it can happen in a younger age group.
It can happen in a younger age group. Even cataract, but for cataract, it has to do with maybe trauma.
With trauma?
Yes, with trauma, you can have it in the younger people. But sometimes they have what we call congenital cataract. And when you are talking about, everybody has a natural eye lens in the eye. So if the eye lens is cloudy, Or if it's cloudy or as if there's something like that, that means the lens is not clear. If the lens is not clear, that means you're having cataracts.
Okay.
Everyone has a natural eyeglass inside the eye.
Inside the eye itself.
Yes, that's where light pass through.
To fall on the retina.
Yes.
Okay.
Or if that lens is no longer clear, that's what leads to cataracts.
Alright. So back to age-related macular degeneration. What are those things that the elderly people may perceive that will tell them that, you know, this is what is going on, I need to go and see a doctor?
You can see when you are looking at things, or maybe a straight line, you see something like a dent.
Okay.
You see something like a dent. Maybe you are looking at this thing, you just see a big full stop.
On a straight line?
Yes, on a straight line like this, you can see a big full stop. On the line, maybe you are reading something, or this door frame now, see a big dot there.
Like an actual dot, or?
No, that's the blurry vision. Not.
Okay, so, okay.
You just see that things are not clear.
So you mean that you are following a straight line, and all of a sudden
things you just become blurry around, but when you look for that,
it's clear.
It's clear.
Hence the dot.
That's the need for you to go to the clinic for them to check the eye. Because if maybe it's because there's something in my eye, it just wants to clean it and the rest. No. Go and check.
Get eyes checked.
Yes, early detection, because most of these causes of gradual loss of vision can be prevented with routine eye checkup. You don't need to wait most times. You can always check your eye. You don't need to wait at the last minute before you go and check that. You don't need to wait till something happen
before you go and check.
Before you go and check the eye.
Interesting.
It's like me drinking this water now. Sometimes you are not thirsty or dehydrated, but maybe you want to just take something, put something in the mouth, just want to drink something.
So the same thing too. You don't need to wait.
You don't need to wait in the last minute. Early to bed, early to rise, and routine eye check will help you to improve your eye.
There you have it, folks. Eye check as regularly as possible. You don't need to wait until you come down with an issue. And furthermore, it's actually a good thing, so you know the actual standing of your body. It's not until when there's something wrong before you go and get an eye check. So this Instagram live session has been brought to you, or is being brought to you by Limi Group of Hospitals, and what we're talking about is gradual loss of vision with here my friend Dr. Yvonne, our resident optometrist. Hope your questions are coming in so that we'll be tackling those questions soon enough. Now, aside from these three things, is there any other thing else that you've noticed in your practice that may lead to this gradual loss of vision?
Yes, like I said, the diabetic retinopathy.
Yes, diabetic is the big one.
Yes, a big name. Complication of diabetes. It's like you're not taking care of your health. You know, it can lead to diabetes. You're not taking care of your health because of increase in sugar level. And the complication, one of the complications is the big word, like you said, diabetic retinopathy. It affects the eye.
But that's the loss of vision in diabetic retinopathy. Is it as gradual as the others, or it's slightly faster, or it's more sudden?
It's still gradual. Because first, if you are taking care of your health issue, diabetes, it will not lead to that. But if you are not taking care of it, it can be because it's a complication
of diabetes.
Yes.
Okay, so in diabetic retinopathy, what are those things that the person will see in their field of vision Is it dots, or is it blurry, or is it haziness?
It's going to be a blurry vision. Sometimes they'll tell you, because the sugar level is high, they'll tell you, I had a patient like that few months ago. We still keep in touch. I say, doctor, my glasses, it's as if it's not clear. I say, calm down. Have you checked your sugar level? Oh, yes, oh, I've not checked it. I will also ask him, are you taking your drugs? Oh, doctor, you know we just finished this salad this thing. So I was not able to go through the normal time because of the salad. I'll say, I understand, but you are done with it. You can continue. And not you only taking your drugs. You have to do exercise. You have to exercise.
Well, is it reversible? Because if we say that it's a complication of high blood sugar, right? If one is now able to control the sugar and make it, within the acceptable range, does that improve or reverse the effects of the damage caused by the high blood sugar?
It will not reverse it, but it will help to maintain.
Okay, so that means it will not reverse, but to not allow further
damage.
Okay.
To occur.
All right.
You understand?
Yes.
It's not like glaucoma, vision loss. Not going back, cannot be regained.
But with diabetic retinopathy, there's
still
some hope.
Yes, you can still take your medication, and we pray most times that it does not get to that stage.
Before you turn in.
Before you turn in new leaf, before you know, okay, there are things I can do, reduce smoking, no smoking, not even reduce it, no smoking. Alcohol, you try to change your lifestyle. Because if you don't take care of yourself, nobody will take care of you. Right. So you have to learn to take care of yourself. You have to learn to take your medication. You have to learn to be in charge of yourself. And don't wait for somebody to tell you this is what you are supposed to do.
Okay.
You understand?
Yeah.
And for...
You're really keeping hydrated.
Yes. As I'm talking, I need to drink the water to
That's good, that's good. Yeah. So
okay, yeah, I think I see question coming in.
Okay.
About sudden loss
of vision.
Oh. There are so many things that can cause sudden loss of vision.
Okay.
Retina detachment can cause sudden loss of vision. Trauma to the eye can cause sudden loss of vision. Due to a blow to the eye or car accident can cause sudden loss of vision. Retina artery occlusion can cause sudden loss of vision.
Okay.
Yes, those are a few, but they are wow. Those and in the retina detachment, once the retina is detached, it is not an easy task.
It's not an easy task.
Yes, you need to see the doctor ASAP, immediately.
To get yourself sorted out.
Yes, if not, light falls on the retina for you to see. That means
that's the blindness.
Yes.
Wow.
The ultimate goal for glaucoma.
For glaucoma. Wow.
Yes, the ultimate goal for
glaucoma. So you also mentioned cataract.
Yes, cataract.
How common is cataract?
Oh, you see it. So you see it often, but it's not as common
as it used to be.
Refractive error or glaucoma. You see cataract. You see some people say when you're looking at the picture, when you're looking at the picture at the lens, you see it's as if there's a white thing covering the lens.
Like that's from the outside.
Yes, when you're looking at it.
Okay, what about the people who suffer from the cataract? What do they see from the...
Wait, okay, what they see is to tell you that they are having cloudy vision, or when they wake up, it's as if they see something like dew coming in. It's as if they see dew when they wake up in the morning.
Okay, like dew.
Like dew.
Okay. Okay, like dew. Like a fog or something.
Yes, for covering their eyes.
Covering their eyes.
And you know, one thing with, before the cataract gets to that stage, like the name implies, the topic we are talking about,
gradual loss of vision, yes.
It happens gradually. First, you say immature cataract. That means the cataract is not mature. And when we say cataract, remember, like I said, everybody has a natural eye glass. But once that glass is cloudy, that's what leads to cataract. So gradual, it gets to immature, from immature to mature cataract.
So hence a cause of gradual loss of vision.
That's right.
Wow, that's interesting.
From weeks to years, it can take time. It will not just happen suddenly. The only condition it can happen suddenly is when there's a trauma.
When there's a trauma. Oh, okay.
Or disease condition, or maybe things like diabetes can help too. It's one of the risk factors. Okay, it's a risk factor.
Yes. To that. Okay. That's interesting. Thank you for joining us once again on this Instagram live session. My name is Dr. Gradual. I'm a personal physician at the Limi Hospital Group. With me is our resident optometrist, Dr. Yvonne, and we're talking about gradual loss of vision. I hope you guys have learned as much as I have. It's actually a refresher course and also an update on some of the common trends on this topic. So, Doc, we've talked a lot extensively about this gradual loss of vision. Going forward, right, what do you think should be the general attitude towards this condition?
Like I said, the eye is the window to the world. And you know that without the eye, you can do little or nothing. Since you know you can do little or nothing without the eye. Even when you go to the office, like the patient I said I saw today, he said, "Oh, doctor, I can't go to the office." I said, "Yes, you can't go to the office. Because what do you want to use to see to work? It's the eye. And if the eye is not performing well the way it should, how are you going to work?"
That's a big one.
You can't work. He said when the boss called and said, "Oh, please sir, I can't come to the office today, or I'll be late in coming." He said, the boss said, "Since it's your eye, and without the eye, you'll not be productive in the office. So there's no need. Take your time, but make sure on Monday you should be in the office." So he said, "Thank you, boss." So I told him, you see, the eye, I also told him the eye is a window to the world. So routine eye check is necessary. Because even without the eye, you're not allowed the best doctor to see you.
To see you. Basically, everybody is useless without the eyes.
Yes, and without the eye, the money you are working towards, you're not see it to count. Yes! Without the eye, you not see your loved ones. You can hear their voice, yes. And you know the eye is part of the sense organ, one of the sense organ.
So that means we really take it for granted because it's so commonplace. The gift of sight is so commonplace.
The eye, you know the way you open the window, when you open the window you see very well. That's the way the eye is.
Interesting.
And you know it's one of the sense organs. But nobody, the only time they recognize there's something wrong with the eye is when they say, "Oh, my eye is red. Oh, I am
or there's something coming out.
Or you are having discharge or something." I think I can see a question coming in.
Okay. The question says, "I'm short-sighted. I got glasses in December 2022, but my sight seems to be decreasing. I do have teary eyes sometimes. What do I need to do?"
you need to go for a proper eye checkup.
Okay.
For them to check your eyes.
Okay, but
Like
when you say, sorry to cut you short, when you say proper eye checkup, is it just checking visual acuity using the Snell's chart, or there's more to be done?
There's more tests to be done. Like he said, he got his glasses December 2022, and we are in
2023.
We are in 2023, but we are in May, and at least you can change your glasses maximum every 2 years. So it is good for you to check the eye to know what is going on. So we have to use our instruments. And when you come to Limi Hospital, we can help you do that. We check the eye properly. We give you a comprehensive eye checkup for you to know, oh, the glasses, is there something wrong with the glasses? Is there something wrong with my eye?
Well, you know, doc, they say better soap than money kill 'em. Is it affordable? By a certain standard.
We are affordable, and
For
we
the
have
kind of care we offer.
Yes, and we have different packages.
Oh, that's wonderful.
But when you come, the customer care service will give you all the necessary answers
Information that you
need.
require. All right. So that means right from the beginning of your care, from stepping into the hospital to actually seeing a doctor and getting your problem solved, there's somebody that is going to be with you every step of the way, isn't it?
Like you said, every step of the
way.
There's somebody to guide you.
All right. Another question. How can sudden vision loss be prevented? Then another one to follow up. Can pepper in the eye can pepper in the eye cause blindness?
Okay, we'll take it one at a time. Can pepper in the eye cause blindness? No.
So all those village people, all those wicked aunties rubbing pepper in water.
No, it cannot cause blindness. It can cause irritation.
It can cause irritation, okay.
It can cause irritation, it can cause discomfort, ocular discomfort, but it will not lead to blindness.
Okay. But can that pepper, after causing irritation, maybe cause some scarring during the healing process?
Yes. That's why you need to go for a checkup. So that you know that, okay, excuse me, this pepper that enter my, is it causing further damage at the back of the eye? You know, everything. You see the front of the eye, but you don't see the back.
You don't see the back, you don't see what goes on even within the eye and all of that.
And maybe when the pepper enter the eye, you never can tell. Before then, maybe you were even having issues with the eye.
Maybe. That's very possible. That is very true. Even before the pepper entered the eye, there might have been something there just underneath the surface waiting to come out.
And you are not worried about it.
Okay.
But when the pepper entered the eye, you'll be forced to go to the hospital.
Alright. So somebody asked, the first question was, how can sudden loss of vision be prevented?
By routine eye checkup.
Routine eye checkup.
Yes.
All right.
By routine eye checkup, that's the only way. Because if you see sitting down at home and you say, oh, I'm not seeing well. It's like somebody praying, oh God, help me to get a job. You are sitting down at home. You are not submitting your CV.
You're not taking courses. You're not refining yourself.
You're not taking you're not taking those steps. You are not going out to submit your CV. How will you get the job? As our Heavenly Father is doing his own, you too, you'll be playing your own part.
Alright, fair enough. Other questions coming up? Okay, another question. Who do I need to see the doctor regarding my eye pain? Okay, so I think this person is trying to say, which doctor do I see when I have eye pain? Is it the general physician or is it the optometrist?
You see an optometrist.
Okay.
An optometrist will check the eye properly. A GP will do his own part, but he will not give you a thorough checkup. It's like you having heart issues. It's like you having heart issues and you say you want to go and see
Okay, it doesn't.
No. When you're having health issues, you see a cardiologist. You understand? So when you're having eye pain, you see the people that are in charge
of that thing.
Yes.
Okay, so at what point does one present to the hospital? Is it immediately the eye pain comes, or do you manage yourself a bit and swallow paracetamol? Then after that, if it doesn't go, they say in those malaria advertisements, if symptoms persist after 3 days, please consult your doctor. So in this scenario now, when the eye pain is there, at how many days does one actually make that move to see an eye doctor?
Immediately, ASAP. You don't wait.
ASAP, you don't wait.
The eye, like I said, is the window to the world. So you don't wait for the eye pain to get worse before you see a doctor.
Okay. Then another question. So you've heard it, guys. Once the eye pain comes, try and see the doctor as soon as possible, the eye doctor at that. Then another question says, my eyes are always teary. What can be the cause?
So many things can be the cause. Allergy.
Okay.
You know, right now it is raining.
Yes.
So before the rain, you see sometimes it's windy. If it's windy, it can cause tearing. And when particles enter the eyes, you can have allergies.
You can have allergies as
and
well.
you can be tearing.
You can be tearing.
Refraction too can cause tearing.
That refractive errors too can cause tearing.
Yes.
Okay. So tearing of the eye, is this something that one should be worried about?
In a way, yes.
In a way, yes.
Yes, because allergy. So you just, it's an allergy. When I say allergy, I mean allergic conjunctivitis. What is an allergy? You just relax and rest. Anything that concerns the eye, you don't relax. You have to be always
on point.
On point.
Okay.
You don't wait because the eye does not have duplicates.
No, it doesn't actually. So another question is blindness hereditary?
Yes, blindness can be hereditary. You know, we talked about glaucoma.
Yes, we talked about glaucoma.
And glaucoma, one of the risk factors, it can be hereditary.
Is it only glaucoma, or there are other conditions too that can be hereditary that can lead to blindness?
Trauma is not hereditary. You know, when you have a blow to the eye, it depends on the part of the eye that is affected. Okay. If it has to do with the retina, it can lead to blindness.
Can lead to blindness.
Yes.
Okay.
Because the retina is where light falls on for you to see.
Okay, so
unlike it's the corner at the front of the eye, it falls on the retina for you to see.
Okay.
And if you are not seeing, means you are blind. If you are not seeing. Yes.
That is interesting. So there you have it, folks. We've talked extensively on gradual loss of vision, courtesy the Limi Hospital Group, and this topic has been taken extensively by Dr. Yvonne, a resident optometrist. At this point in time, I'd like to thank you for taking your time out of your busy schedule to be with us and to learn more on this topic. From me, Dr. Gradual, and from Dr. Yvonne, we'd like to say thank you for being part of this program and have a wonderful weekend.
And please remember, the eye is the window to the world.
Thank you.